And now we turn back to COVID as we surpass 420,000 American lives lost. We look back almost a year ago to the scientists who tried to warn officials that the situation was far more dire than many people realized. One of those doctors was James Lawler, correctly predicted our current death toll and told ABC News in July that we're not yet at the intermission of this twisted story. What is his latest warning? ABC's Trevor Ault reports.
There is growing concern at this hour over a possible outbreak of a mystery virus.
In January 2020, the final moments before COVID-19 would change society forever, much of the world was ignorant to the looming reality.
Chinese health authorities are still working to identify the virus behind a pneumonia outbreak in the central city of Wuhan.
The CDC says the risk to the American public is low, but they want to be ready.
But a group of current and former government officials and scientists were watching closely and saw the horrific writing on the wall. In a series of email chains called Red Dawn, Dr. James Lawler, an infectious disease specialist who served in the Obama and Bush administrations, reacted to Pentagon officials waving off the pandemic as essentially a bad flu.
This was my somewhat tongue-in-cheek response to that, and I described great understatements in history. Napoleon's retreat from Moscow, just a little stroll gone bad. Pompeii, a bit of a dust storm. Hiroshima, a bad summer heat wave. And Wuhan, just a bad flu season.
In early February, the Red Dawn group turned their focus to the Diamond Princess, a cruise ship off the coast of Japan, which was overrun with an outbreak of COVID-19.
The number of confirmed novel coronavirus cases on board this quarantined cruise ship nearly doubling.
There are more than 200 people with the virus on board this cruise ship.
With the ship then under intensive quarantine measures, Dr. Lawler was part of the team climbing on board to investigate the virus's rapid spread, validating his deep concerns.
Despite these pretty aggressive infection control measures that passengers were taking, they were continuing to get sick and to be identified as cases. And so that really brought home to us the potentially explosive transmission that could occur.
Things are just totally crazy right now.
By that point, the virus had already landed in the U.S., soon exposing a testing system that was woefully unprepared. But many top officials, including President Trump, continued to downplay the threat. Trump even suggesting his administration's response to coronavirus would be more effective than President Obama's handling of the swine flu, referencing a death toll that now seems meager by comparison.
What they did and the mistakes they've made, they were terrible. They were horrific mistakes. 17,000 people died.
However, weeks before, Dr. Lawler was sounding the alarm about an outcome far more grim. In a private webinar with the American Hospital Association, he estimated a coronavirus death toll of 480,000 Americans, a calculation he called conservative. And unfortunately, 11 months later, he's been proven right. This week, the U.S. roaring past 425,000 deaths, on pace to potentially eclipse Lawler's estimate next month. We last spoke with Dr. Lawler in July, where he had this ominous warning about what was lying ahead.
There are still a lot of twists and turns in the plot of this movie, so I think we're not even yet to intermission. And so we're going to have, I think, unfortunately, a few more surprises and a few cliffhangers left.
Trevor Ault, ABC News, New York.
Certainly a drama that we would all like to see end very soon. Dr. James Lawler is here with us tonight. Doctor, thank you so much for your time. I want to pick up on that idea of cliffhangers that you feel are still to come. You said back in July that the virus could still surprise us. How worried are you about the new variants, and do these mutations make it harder to model and predict the course of the pandemic?
Well, they do make it harder to predict, and we're learning more every day. I am concerned that these new variants are potentially more transmissible. There are certainly concerns that the new variants that we've seen in South Africa and Brazil may also be able to evade some of the therapeutics that we have, and even may render our vaccines slightly less effective, although we don't have definitive proof of that yet. I think it's also true that they seem to presage the arrival of of other variants that we may not have recognized yet, and even variants that could pop up on their own spontaneously in the U.S. And so just means we have a little bit more of a complicated problem than we thought.
Almost a year ago, you said that 480,000 Americans could die from COVID-19. Describe the response that you got back then, because it sounds like some people were trying to really disassociate with that thinking. And give us a sense of what your thoughts are now that your predictions sadly seem to be coming true.
Right. Well, at the time, there was certainly a lot of shock and disbelief at those estimates, although to be honest, it was just doing the math. And I think that a lot of infectious disease modelers had predicted very similar courses. It is obviously sad that we've potentially exceeded those numbers. We still have a month to go before, I think it's been a year since that prediction. So we probably will come in higher. And I think this reflects the fact that we've really not done a great job of mitigating the impact of the pandemic.
Earlier this week, I asked Dr. Fauci, looking back, what he would do over if he could. Here was his response.
You know, very likely it would have been early on to really try to get as much more information about the fact that this virus can be spread by people without symptoms. We did not know that then. I wish that I had known it earlier than I knew it, because if I did, there would have likely been differences and more stringent recommendations.
Do you think that officials should have known, or guessed at least, that asymptomatic people could still spread the virus, and was that a major mistake?
I think it was a mistake. I think that the evidence was there. Clearly, there was evidence that asymptomatic people were able to shed virus and shed it in quantities that should be concerning for transmission. And at the time, I think people, even experts, didn't want to believe it, and so found any excuse they could to discount the data and discount the observations that they were seeing. But we should have known that very early on. In fact, there were many in late January that were proposing that exactly that scenario, that asymptomatic transmission is going to turn out to be an important mechanism for COVID-19. And we should have taken more aggressive actions early.
What lessons should the Biden administration take away from what's gone wrong? And what do you think, or do you think, I should ask, that they'll do a better job than the Trump administration?
I think messaging has to be one of the top priorities. So much has been lost in the messaging so far in the last year, and it's allowed for confusion and more tragically, disinformation to really sweep through large segments of the population. And that's created a situation where we haven't been able to act in a unified manner as a country. So hopefully focusing on that messaging and education and public awareness will be one focus for the new administration. And then obviously rolling out the vaccines will be another major challenge.
Lastly, and it's really a two-parter, curious if you hold the Trump administration accountable for how high the death toll is in this country. And I guess a little bit afraid to ask, but what do you think ultimately the death toll will be in this country?
It's clear that we're going to see deaths from COVID-19 for a long time in this country. Even after the vaccine is fully rolled out, we'll continue to see a long tail of deaths, and we'll probably never be rid of those, right? They'll occur at a very low level, similar to deaths that we see from pneumococcal pneumonia. But I think we'll still accumulate a large number of deaths over the next year, and possibly several 100,000 more, unfortunately. With regards to the last administration, I think there's mistakes were made at many levels, up and down the bureaucracy at federal level, state and local levels as well. Clearly, one thing that was missing was strong national leadership coming from the White House in discussing the seriousness of the threat and creating unity of action among the people. Even something as simple as wearing a face mask, if we could have had consistent messaging from the White House, I think that would have made a significant impact. And we can look at countries that have done it well, countries like Japan, which have had a dramatically lower rate of deaths per population than the U.S. So it's not true that there's nothing we could have done. We could have done a lot differently, and we would have been in a much better position had we taken actions early on and focused nationally.
We appreciate your insight and your time tonight, Dr. Lawler. Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.